Today we are going to talk about an important topic related to women's health, breast cancer. It is one of the most common cancers affecting women worldwide. But here's the good news. If detected early and treated properly, most patients have very good outcomes. So understanding breast cancer is like giving yourself an extra layer of protection. Breast cancer occurs when cells in the breast grow uncontrollably, forming a lump that can sometimes spread to other parts of the body. Globally, breast cancer is the most frequently diagnosed cancer in women, while it mainly occurs in women aged from 40 years old to 69 years old. Younger women are also increasingly affected. This picture is the illustration of the female breast anatomy. On the left, a front view shows lymph nodes inside the breast, going from the breast to the armpit. And on the left side, a cross-section shows the chest wall, ribs, fatty tissue, lobes, ducts, and lobulus. Also shown in both panels are the muscle, nipple, and areola. And we know that the female breast contains lobulus, and ducts that produce and transport milk to the nipple. Fatty tissue gives the breast its shape, while muscles and the chest wall provide support. The lymphatic system, including lymph nodes, filter lymph, and store white blood cells that helps fight infection and diseases. So, who is at higher risk? First of all, of course, getting older and having a family history of breast cancer. And then certain genetic mutations like breast cancer genes, one or two, or both. Longer lifetime exposure to estrogen, such as early menstruation, late menopause, not having children or not breastfeeding at all, unhealthy lifestyles, most importantly, such as obesity, lack of exercise, regular alcohol consumption. And then many may wonder, how do I know if something is wrong? Early breast cancer often shows no obvious symptoms, which is why regular screening is so important. But some signs to watch, they are such as a lump in the breast or armpit, nipple changes such as inversion or unusual discharge, or skin changes like dimpling or orange peel texture, redness, swelling, which you don't know the reason for, or sores that won't heal. If you notice any of this, please see a doctor promptly. How can we catch breast cancer early? Here are the key points. First, do monthly breast self-exams, ideally about a week after period ends. Look at your breasts in the mirror and feel for lumps. Second, professional screening is essential. Women aged 40 years old and above should have mammograms every 1 to 2 years. Those with high risk should talk to their doctor about earlier or more frequent screening and possibly MRI. Remember, early stage breast cancer has a cure rate above 90%. If diagnosed, don't panic. There are many effective treatments available now. Surgery, either conserving the breast or removing it entirely, radiation therapy, chemotherapy, hormonal therapy for hormone-sensitive tumors. We also have targeted and immunotherapies for specific cancer subtypes. Doctors tailor treatment based on each patient's condition, improving survival and quality of life. So, most importantly, prevention and, meanwhile, having healthy habits. Prevention starts with a healthy lifestyle. Maintaining a healthy weight and exercise regularly, eating a balanced diet, and limit alcohol consuming. Breastfeeding can reduce risk. Also get regular checkups and build breast awareness into your routine. Breast cancer is not something to fear if we catch it early. The key is awareness, early detection, and timely treatment. I hope today's information help you and those around you stay vigilant and healthy. Thank you for watching.